Uganda has for long been grappling with poor staffing in health facilities. Not only are doctors fewer, but so are general nurses and experts from other medical fields. The general nurse-to-patient ratio in the country stands at one nurse for every 11,000 people against a World Health Organization recommendation of one nurse for every 500 people. The impact of gross understaffing is very visible in districts such as Mbarara and Kabale, a factor that has worried researchers since these places are considered reachable and very accessible.
Mbarara is the least staffed in southwestern region, Mbarara district, at about 49% staffing level. And Kabale Regional Referral Hospital is also chronically poorly staffed for whatever reason. I mean, it's a beautiful place, it is an urban center, but for some reason you find it understaffed.
The permanent secretary of the Ministry of Health, Dr. Asuman Lukwago, blames political leaders whom he accuses of making it difficult for health workers and professionals to work in the area.
If you do negative publicity, nobody will come to your place. These are qualified people. I'm not saying that they should do wrong, but they need to be respected. If you're a chairman for LC 3, you're a chairman for LC 5, and you feel that you are going to gain a lot of votes by abusing doctors and so on, they will abandon your place.
The permanent secretary says that although they have not hit the 100% mark for the required health workers, the situation has improved from what it was 5 to 10 years ago.
We are now about 70% staffing level on average, but about 2-3 years ago we were at around 56. So the addition of that 20 plus is a good growth. It's a good growth because it's bringing us from a situation where we had banned any recruitment.
Some of the advocates for better health, however, point at low wages as a key driver of understaffing and absenteeism.
Patients are citizens, they pay taxes. They will lose trust in the health facility because every time they come, they don't get a health worker. Every time they come, they take long on the line to be served. And that compromises the right to health, which is a critical thing that Ministry of Health, which is a custodian to the WHO Constitution, should be promoting.
And the in-charges should hold accountable their staff. And if the in-charges are not doing it, then let them be replaced with people who are willing to hold others accountable. Accountability is the only issue. Because a health officer disappears, or a nurse or midwife disappears, and nobody asks questions. People sit day 1, day 2. We have places where people have been told by the in-charges that they can only go to the health facility once a week.
The permanent secretary said the problem is due to a recruitment cap in the health sector.
The staff ceiling is a bit old. It was created based on a smaller population. Now we are talking of a population which is closer to 40 million, using the staff ceiling which was designed about 20 years ago. So that one technically creates an absenteeism.
The problem of accommodation for health workers may, however, persist for some time. Uganda's health budget takes less than 10% of the overall budget, and the government finds itself under immense pressure from the rising population and advocates for better health to improve the quality of health care. Suhail Mugabi, NTV.